It's another walk and talk, y'all. So I am going to be on an upcoming podcast talking about perimenopausal skin. So I thought, let's talk a little bit about that on my Sunday walk. And I think some important stats to know. So women start experiencing perimenopausal symptoms as much as a decade before they get their last period. And it usually manifests as things like mood changes, energy changes, sleep disruption, warmth, hot flashes. And this is due to a lot of the hormonal changes, drops in estrogen, drops in progesterone that are happening in our body. And this greatly affects our skin. So in the 5 years after you have your last period, you lose as much as 30% of the collagen in your skin. That's a lot, ladies. And every year thereafter, you can lose about 2.1% per year. So what do we do as dermatologists to help support that? Well, lately, I've been having a lot of conversations about women proactively talking to their healthcare providers to see if hormone replacement therapy is appropriate for them. Because we know, if appropriate, the sooner they get those hormones back, we can actually maintain their collagen and help so many of their tissues. There are estrogen receptors in our joints. That's what causes frozen shoulder in perimenopause. There are estrogen receptors in our brain, so we can help with cognition. There are estrogen receptors in every single cell of our skin. So our keratinocytes, our skin cells, our melanocytes, our pigment-producing cells, our fibroblasts, which produce collagen and elastin, all of them have estrogen receptors. In addition, so do our blood vessels in our skin. And so things like rosacea flares, our oil glands and our hair follicles also have estrogen receptors. So that imbalance where we get more androgen sort of predominance, so things more like testosterone and progesterone dominating over estrogen, that's caused by these perimenopausal changes. And that can cause hirsutism, so growing hair in areas that you don't, but also female pattern hair loss. And frontal fibrosing alopecia has also been linked to the perimenopausal time. So beyond hormone replacement therapy, what can we actually do here in the dermatology office? Well, there is a ton. Number one is good skincare. Hands down, wear your sunscreen. You need to protect all your collagen. In addition to that, we want to think about in-office procedures that build, maintain, and grow collagen and elastin. One of the top injectables that I use, collagen stimulators. Things like polylactic acid, things like calcium hydroxyapatite. Those go by the brand names of Sculptra and Radiesse. They're really key to bringing back type 1 structural collagen and causing new elastin fiber growth to help maintain the resiliency of our skin. We also use lasers, energy-based devices, such as microneedling radiofrequency at superficial settings to help stimulate hair growth. And in addition, help with the skin. We also have, for hair loss, many women are great candidates for oral minoxidil and some sort of hair supplement, things like Nutrafol or Extress A if you prefer a gummy over a pill. But there's so much that we can do. So I think first, see if you're having symptoms, because I feel like so many women adapt and they just think this is my new normal. It's not normal, and you should get it checked out. And so many women are good candidates for hormone replacement therapy. So talk to your healthcare provider about that. Number two is make sure we're supporting your skin, both with topical therapies, but thinking about injectable therapies, thinking about lasers, light-based devices, or things like microneedling, radiofrequency to help restore some of this collagen and elastin. And then lastly, I think great habits. Take care of yourself. You can see this is Sunday. I'm at the ocean. Make sure that you're doing things that inspire you. Take a little time for yourself. Make sure you're getting great sleep. In my personal opinion, minimizing alcohol intake so that you're getting great sleep and you're doing good things for your skin. Eating well, making sure you've got a sense of community. I'm breaking off solely now, but I'm with a group of girlfriends every weekend doing this. And ask smart providers how you can make your skin better. How can you keep your body healthy? Hope this helps.